Good morning, everybody. Today we will talk about radiation protection in nuclear medicine. First, I want to introduce myself. My name is Masha Al-Khalaf and I'm a nuclear medicine specialist. And my colleague Hassan Rabah, she's also nuclear medicine specialist. This lecture done by Maryam Mujarwa and she is chief technologist. First, I want to talk about the hazard in nuclear medicine. There are a lot of hazards in nuclear medicine, like mechanical, electrical, fire, and biological, and radiation also. We will concentrate in this lecture about the radiation part. ALARA is a radiation protection safety rules. ALARA mean A as, L low, A as, R reasonably, A achievable. How we can follow ALARA rules? By 4 principles: time, distance, shielding, and contamination control. I will explain each one alone. Minimize the time will minimize the time of exposure. So as much as we can decrease the time of exposure, like the time of contacting with the injected patient. Distance. We maintain the distance from the injected patient by inverse square law. So as much as we can increase the distance from the radiation source or the injected patient will minimize the amount of exposure. Shielding. All the radioactive material must be kept in lead shielded container to reduce the exposure. All our material are shielded, like the kits and the generator. Contamination control. Protecting ourselves from the radioactive contamination by white coat with a closing button, gloves, and we use double gloves for more safety. Plastic cover shoes in case there is a spill in the floor.
Thank you, Masha'il. There are 4 sources of radiation exposure in nuclear medicine. Injected patients, radioactive waste like cottons and syringes, patients' body fluids like urine and blood, radioactive dose. How to reduce radiation exposures post-injection for the patients? First, patient should be well hydrated. He should drink lots of water to get rid from the radiations which has been injected per the study. As noted in items 2, flush down the toilets 2 times for more safety for the next users. Avoid close contact with infants minimum 6 hours. Mainly we use technetiums and the physical half-life for technetiums is 6 hours. So it depends on the radioactive material which we use. There is 2 sources of contaminations: injected patients, spills of radioactive doses. Injected patients could be from urine, saliva, vomiting, and blood. Spills of radioactive doses could be during injected patients or drawing the dose. The contaminations could happen on surface or human body. In case the radioactive spills on surface, we should follow steps to clean the radioactive material. First, alert all people about the contaminations area, and the technologists are responsible to deal with any contaminations. Using protective clothing and gloves determine the boundary of the spill and blot with an absorbent tissue. Then remove the tissue and wash the area with radioactive detergent or soap and water. Wipe with a towel or tissue from the edge of the contamination area toward the center. Keep the gloves and paper towel in a plastic bag with a radioactive hazard label. Keep the radioactive waste in assigned lead shielded area for a half-life period, then discard as biohazard. And the last, survey the area with a survey meter. If there is any contamination, we will repeat these steps again. In case the radioactive spills in our body or patient's body, we should follow also steps to clean these contaminations. First, remove the contaminated clothing immediately and keep it in a plastic bag with a radioactive hazard labeled, as shown in these pictures. Second, keep the radioactive waste in assigned lead shielded area until half-life is over. Third, wash the contaminated skin with running tap water 2 to 3 minutes and do not scrap it. And the last, survey the contaminated skin with a survey meters. How can we deal with radioactive waste disposal? First, all radioactive material container must be closed before disposal. Then radioactive waste must never be placed in non-radioactive waste containers. Radioactive waste must be kept in a special lead-shielded waste container labeled with radioactive sign. Store the radioactive waste 5 half-life, then discard as biohazard. Now we will show you some of our images, how we prepare the radioactive material. In first image, we get the kit from the refrigerator. Then we drawing the dose. Then we adjusting the dose for each patient. Then we discard the waste in a special lid container waste. In case the contamination in floor, how we can deal with it? First, we put the radioactive wash. Then we wipe it by using the towel. Then we put this tissue or towel in a plastic bag with a radioactive hazard label. Then we put this plastic bag in a special lead container. Thank you for your listening. Any questions?
What's meant by 5 half-life?
5 half-life of the each radioactive material.
Half-life?
Each radioactive material.
Half-life multiplied by 5?
Yes.
For example, technician has 6 hours of life.
So
in 6 hours, the radioactivity reduces to half. So you have to